and Medicare Advantage, the ins and outs of both of them. I'm Louise Blasius. I'm the hospital social worker here, and I'm also a certified Medicare Medicaid counselor by Region 7 Area Agency on Aging. And this is my partner, Tanya Maybe, in Lunch and Learn and Healthy Lifestyles. And we do this for calendar years, but we skip November. So our next workshop for Healthy Lifestyle is at 5:30 Monday night, and it's on portion control, diet, and exercise with our physical therapist, Dr. Jenny Long, and our registered dietitian, Charlene Beasel. So that will be good to keep in mind as the holiday seasons approach us. And our November Healthy Lifestyle is on immunizations for adults. And Brandy Tripkowski does an absolute wonderful job on that. I hope we've all gotten our flu shots. Show of hands. All right, me too. And then it's important for adults to think about shingles and the shingles booster. I said yesterday when we got talking about shingles, I wouldn't wish shingles on my worst enemy. And then the pneumonia shot is also very important to get. So you can learn more about all of the immunizations we should have on November 20th. And next year, I'm really excited. The idea was brought forward that we put Lunch and Learn and Healthy Lifestyles on one brochure. Do you like that idea? Yes. All right. Does anybody need a schedule right now? So first off, we need to know terms. So Medicare, there's coinsurance, and that means the part that we pay. Typically, that's a percentage, a 20% copay. So, for example, with Medicare Part B, that will pay 80% of outpatient services with a 20% copay. Then there's a co-payment, and that's usually a dollar amount. So you might have a $5 copayment or a $10 copayment on your prescription plan. A deductible is what you have to pay yourself, and then Medicare can kick in entirely. So right now, on your handout, it should read the top page is Part A costs. Most people who have a work history get Medicare Part A at no cost. Without a work history, the premium for Medicare Part A is $437. The deductible for Part A is, in 2019, was the premium for Part B in 2019 was $135.50. And then the other options are your drug plans or your Medicare Advantage plans. And the deductible for Medicare is $1,600 every 60 days. The Medicare Savings Program is a program that seniors can qualify for to help pay for their Medicare premiums. Medicaid is for low-income seniors. I particularly see Medicaid coming into place if there's a community spouse, someone who's well and living at home, and then a partner or spouse that needs to be in the nursing home. And the rules when there's a community spouse are completely more liberal than at any other time, because more than 30 years ago, the federal government said the community spouse shouldn't have to go to the poorhouse because their wife or husband needs nursing home care. The Medicare Advantage plans, we're seeing more and more of that. Instead of having original Medicare, you have an Advantage plan. Sometimes retired teachers have an Advantage plan. Other times you can voluntarily choose to do that. One of the advantages to the Medicare Advantage plan is to go to a nursing home, it does not require a 3-day inpatient stay first. But if you have original Medicare, it does. But you have to be careful when you take a Medicare Advantage plan that your doctor, your hospital, the people you want to go see accept that plan. And then there's a variety of supplemental plans that you can choose from. And I'll walk you through that more fully, but you pay extra for that. So that'll pick up your deductibles on your insurance and your co-pays. The donut hole is when your prescription coverage runs out, but that will be closed, reduced to nothing in 2020. And then the marketplace is also available at Medicare.gov, and that's where you can go and buy health insurance if you don't have any. So last week, I was helping a person whose income was just a little bit too much for Medicaid, but they needed health insurance because they had developed some new cardiac conditions. And the marketplace this year is open November 1st, 2019 through December 7th. So if you don't have any insurance, this is the only time that you can sign up until next year. And then the insurance kicks in January 1st. And this particular person I was helping, their income was low enough that he was going to be able to receive the marketplace insurance premium free, but they all usually have quite a high deductible amount, $4,000, $5,000, $6,000 before it kicks in. But it's better than having no insurance at all. Did some of you receive your book in the mail? Excellent. Okay. So I have important pages flagged for you. And anytime you have a question, as they go along the way, just raise your hand and I'll do my best to answer it. And should you stump me on a question, I will call my Medicare, Medicaid hotline number and be sure to follow up with you. I think one of the things that's really nice, if you see here, it says e-Medicare. They have really and truly updated their website. They designed it to be more user-friendly and handy, and I would agree with that. I have been very pleased with going to Medicare.gov. You can compare your Advantage plans on it, you can compare your drug plans on it, and you can compare your supplemental plans on it. So in your booklet on page 4 and 5, I think it's important to realize the different parts of Medicare and their deadline. Right now, October 15th through December 7th is when you can change your drug plan at no harm, or if you want to change your Medicare Advantage plan, you can sign up to do that, and then the new coverage picks up in January 1st. And For the Medicare Advantage plans, those sign-up dates are January 1st to March 31st. So with original Medicare, there's Part A, and that's what we think of as covering hospital care. Part B covers outpatient care typically, and Part D for drugs covers prescription care. And then most people want to, if you turn the page to 6, most people want to sign up also for a supplemental plan to pick up their co-pays and deductibles. If you would rather switch to a Medicare Advantage plan, you can, and you still pay your Part B premium, but then you can choose an Advantage plan that may have no premium, or maybe a premium up to $100 or more. People tend to like the Advantage plans because of the lower out-of-pocket expenses. But if you already have a supplemental plan and you leave it and you sign up for an Advantage plan, and for whatever reasons you don't like your Advantage plan and you want to go back to original, if you want to go back and pick up your supplemental insurance, they can now pre-existing rate you. So your premium is more than likely going to skyrocket. When you first sign up for a supplemental plan, say on your 65th birthday, or you could be older if you have coverage through work that is considered credible, you can wait to sign up for Part B and a supplemental plan. And at that moment when you're eligible to first sign up, they cannot prior rate you, whether you have a history of COPD, of high blood pressure, of stroke, of cancer, whatever your pre-existing condition might be, they won't rate you on that. Well, once you decide to step away from that because you signed up for an Advantage plan, they can prior rate you. So original Medicare is usually accepted by every doctor and every hospital. With the Medicare Advantage plans, you have to check that your doctor, your nursing home is in network for them. And then your out-of-pocket costs may vary. So it's very important to get very specific with an Advantage plan. What are they and what are they not covering? On page 8, it talks about travel insurance. Typically, original Medicare does not cover you when you're out of the country. People do sign up for temporary health insurance if they know they're going to take a trip. And that's also true for a Medicare Advantage plan as well.
Louise, what would you sign up for then if you were traveling? What would be some options then if you're traveling out of the country?
I really don't know. I would start to Google. If it's within the United States, no problem. But I would Google travel insurance.
Okay, thank you.
Yeah. I like the index of topics, just in case you want to just specifically look up something. Okay.
Louise, there's a question here.
Yes, please.
Now I have supplemental insurance, but thinking of going to the Medicare Advantage program. Why are people leaving the Advantage program to go back to the supplemental? Do you know?
Maybe they didn't do their due diligence and check that their doctor or local nursing home accepted that. And sometimes people need to check with their home care agency too if they accept that Advantage plan. Okay, so very, very important. Our website lists the Advantage plans we accept. Next door, the medical care facility, they've been picking up more Advantage plans. Autumnwood and Deckerville accepts quite a few because they're part of a national corporation, but I would check. And especially your physician's office. If your preferred doctor doesn't accept the Advantage plan, that could be trauma. Or this is early for me to talk about it, but you're bringing it up. Lots of Medicare fraud. We have to be aware of that. So I hate robocalls. I get them every day probably. And here's the rule of thumb. If you don't recognize the phone number, don't answer it. If it's a valid phone call, they'll leave a voicemail message. Now, what are they doing? There's lots of schemes out there for seniors on Medicare. The telemarketers call and they try to get you to sign up for durable medical equipment. And I was explaining this to our physical therapist, and she said, yeah. She said, I had a patient come in with a back brace and it didn't really fit him well. And I asked him how he got it. And he said, I don't know, it came in the mail. And so usually it's an out-of-state doctor ordering a durable medical equipment from an out-of-state supplier, and typically it's an inferior quality product. Another big scheme is genetic testing, and you may want to, with your family doctor, talk it over. If there's a family history and you want some genetic testing with your doctor from a bona fide lab here, you might want to do that. But telemarketers are calling people up and saying, you've got to watch out for your risk of cancer. We can send you this genetic test. Then after they do the genetic testing, then they follow up and say, honey, and that's a quote, if you take this nutritional supplement, you'll reduce your risk of getting cancer. So then there's a sales pitch for that. So I had this one gal, and why I'm bringing it up under Medicare Advantage. She lived on the west side of the county. This Medicare Advantage plan called her up and wanted to sell her their plan and give her prescription coverage. That was their motivation, was getting prescription coverage. They failed to tell her that her closest provider was in Flint. Oh. I know it. So when we talked, she realized that, and actually through Lions Club, I was able to help her get an eye appointment and the new glasses she needed. And every Lions Club will do that. Right, Dave? Yep. Oh, okay.
Anything you want. Yep.
All right. So, like I said, people with a work history typically are automatically enrolled in Medicare Part A. You can sign up 3 months before your 65th birthday and 3 months after your 65th birthday. That's also when you should sign up for Medicare Part B. If you have credible insurance through a spouse's employer or your own employer, you don't have to sign up then, but be sure to keep your letter from your employer that this is credible. Otherwise, there are late penalty fees for not signing up for Part B when you should have. And that's basically 10% additional for every 12 months that you waited to sign up for Part B. And you'll find that flagged on page 22. More questions yet? Okay. Yes?
Is that employer supposed to automatically give you that letter?
I believe so. That happens for me. I get a letter, credible.
Do they have to do it every year?
Yes.
Really?
Yes.
Where do you find the companies, you indicated you have the Medicare Advantage program that would supplement the deductible that you have to pay? In other words, what I'm looking at has a $4,800 deductible.
On your Medicare Advantage plan?
Right. I'm not signed up yet, but that's what I'm saying. You seem to mention that there was another coverage that would help cover that.
Yes, and I'll get to that in just a little bit. It's depending on your income. It's income driven.
Okay.
Okay.
They get you coming and going.
Sometimes people want to know, is this test or service covered? And page 25 talks about that. Again, you can go to medicare.gov and look it up online, new friendly system. You can also call 1-800-MEDICARE, but typically hospital care is covered. Skilled nursing care is covered for up to 90 days. You're not necessarily guaranteed 90 days in a skilled facility, but up to. Hospice care is covered. And in fact, if you sign up for an Advantage plan and then you want to end up needing hospice care or end-stage renal disease, then you have a penalty-free time to go back to original Medicare, because the Advantage plans don't cover hospice or end-stage renal care. Home health care is 100% covered. Okay, and then
What? 100% coverage, is it covered
home care,
under Advantage or?
both. Well, Advantage, you'd have to look at your policy, but under original Medicare, 100% covered, but not forever. That's typically goes in like 6-week spurts. That's, visiting nurse, physical therapy, occupational therapy, can also include a nurse aide, and typically the span of that is 6 weeks.
I'm surprised they don't cover hospice care.
Okay, then hospital care is covered, but there is a deductible every 60 days, and then that increases if you're there more than 61 days, and then eventually there's a limit of 190 lifetime days. Part B is explained on pages 30 and 31, and recently we began looking at diabetic services being covered, and they can be, depending on your diagnoses. The annual wellness visit, that's a wonderful thing to participate in with your local family doctor. And all of our doctors do annual wellness visits. So page 61 talks about Medicare Advantage plans. And depending on your plan, prescription drugs can be covered. If you belong to a Medicare Advantage HMO, you need to participate with your physician. So you have to have a primary care physician in an HMO, and your primary care physician needs to refer you. if you need to see a specialist, if you need other services. And always to see that specialist. In a Medicare Advantage PPO, that stands for Preferred Provider Organization, and then usually you retain free choice of who you see, as long as they're participating in that plan. You can see who you want to see. You don't necessarily need a referral to a specialist. Okay, on page 70, it lists all of the Medicare Advantage plans, A through N. And a lot of people have liked Plan C and Plan F for having the best coverage with, less out-of-pocket expense. This year, at the end of open enrollment, Plan C and Plan F are going to end. If you already have a Plan C and a Plan F, you can continue that. If right now you wanted to sign up with a Plan C or Plan F, you can still do that. But at the end of the year, Plan C and Plan F are disappearing, and we don't know yet what they will be replaced with. Another thing about these plans, A through N, they're all required by regulation to provide the same service. So the only difference between them is the premium. So it's important to shop around and find a good fit for yourself. And again, Medicare.gov will help you do a plan compare for supplemental, for prescription, for Advantage plans. And if someone would like to make an appointment with me to go through any of these choices, you are welcome to do that.
The only difference is the deductibles?
No, premiums.
Premiums.
They all have to require the same
Okay.
service, the same level of care. So Blue Cross might charge this, Farmers Insurance might charge that, but all N's are the same, all L's are the same. You just want to check your premium prices.
Okay.
Okay?
Yeah.
All right. Then page 73 talks about Medicare prescription drug coverage. And I think most people want to have a prescription drug plan. I've worked with some seniors that say, well, I don't take anything, or only take something for blood pressure. That can change. That can change in a blink. So, I would encourage people not to be not having coverage, but to pick up coverage. How much you pay depends on the drug plan you choose. And once a year, everybody should get a formulary. Did you get your formulary this year? That's the book that your drug plan sends you of every medication that's covered. Now is the time to make sure that the medications you currently take are on that list, because you can change your Medicare drug plans without harm. If you need to switch over to a different company because your blood thinner isn't covered, some of those blood thinners are pretty pricey. You'll want to check that out. On page 83, It talks about who can get help for their prescription medications. A single person making less than $18,735 could qualify as long as they had less than $14,390 in the bank or savings or stocks or bonds. For a married couple, that can be up to $25,365 and less than $28,000 in assets. But those asset limits for Medicaid, if one spouse is in a nursing home, way more lenient than that, especially for the assets. You automatically qualify for extra help if you have Medicaid, if you're paying for your Part B premium. And if you don't want to join a Medicare drug plan, you can opt out, or you can see if you qualify for extra help. That's on page 65. And on page 87 and 88, it talks about help getting your prescriptions. So sometimes what I do, every pharmacy in the United States has a pharmaceutical assistance program. And I will go online, I will print out the application. Basically, their programs will help people who don't have a prescription drug plan. And it requires the patient's financial data, and it requires a prescription from their physician. And I've seen pharmaceutical companies work this two ways. They either can mail 3 months worth of the medication to your physician, and every 3 months you go to your physician to pick it up. And now, more recently, they are mailing direct to the patient. It's nice, I think, when the pharmaceutical will do that. It's just mail it direct to the patient. And then I think every 6 months you need to get a new prescription, but that varies. But I do that an awful lot for our patients here who can't otherwise afford their medications. So, I'm a little fast today. You all make me nervous and I talk high speed. Do you have some other questions for me?
You indicated on Medicare Advantage programs about them not covering the hospice care, but yet this one page here where it gave all the percentages, it did, a lot of them did cover 100% hospice.
Those were your Medigap plans though, Louise. They were the Medigap plans. That wasn't the Medicare Advantage plans.
Medigap, okay.
Okay.
What page is that?
Yeah, you're right, Medigap.
Yeah, they're the Medigap. I don't think that's the Medicare Advantage plans.
What page are you on, dear?
70.
Yeah, those are the supplemental plans.
Right.
Plan 70 are the supplemental plans, and they cover hospice care. Yes. Yes. Yep, Medigap does.
Well, okay, it sounds like a dumb question. Where do you get Medigap policy? Where do you get Medigap policy?
You can look online at medicare.gov, or you can go to a local insurance agent here in town, and my only advice is to cost compare.
Okay. See, one of the lucky people that got my policy a few years ago where I don't have any deductibles on it anymore.
Wonderful.
But my premium's gonna be $290 this coming up year. So you tack that on with your Medicare payment and your $75 D, and it's like, yikes. So
Yes.
that's why I'm questioning this Advantage program.
That is the motivation for most of seniors switching over. You can,
I'm talking almost $500 a month, just
right, right.
the
So-
thing that scares me is the deductible, 4,800 or 4,900.
Mhm. Well, there are plans with less deductibles.
I may make them fun.
Yeah,
Because I've had this for years and it's been wonderful. My husband had so many specialists. He had stage 4 cancer. We never paid out of pocket a penny.
I know.
Worked for him. It's not exactly working for me though.
I have had other couples do that.
Well, he's passed away now, but what I'm saying is,
I've had one member of the couple do this, and I've had another member of the couple do
his
that.
health issues. It was
Right.
perfect.
Yeah, I had a teacher who had her husband's, he was retired, but his husband's employer, they took their insurance through there. But then they were changing his retirement benefits, and so she went to the teacher's plan, and he signed up for his own supplemental plan.
Well, Blue Cross doesn't carry this, and they haven't carried it for years, and that's why.
Right.
So it's kind of scary leaving it.
Right. Yeah. When you have good coverage, you just love it. It's
Not when it's going to cost you.
It's a
Big decision.
it's a blessing to have good health insurance, and I think, nationally as a country, we have to look at how we're spending our healthcare dollars, what we can do to make it better. We have 2 registered nurses here at the hospital called care coordinators, and they work with each of the doctor's offices with us, and they help people manage their chronic conditions so they stay healthier, they stay out of the emergency room, they stay out of the hospital, and they stay out of the nursing home. And they gave a wonderful example today. They had a handicapped young man who was diabetic, couldn't read, and he needed help managing his diabetes. They got him videos, and he loves watching his videos, and he's had a complete turnaround in his chronic health conditions because of that. And it's very important for us to manage our blood pressure and any chronic disease we might have. Right. Excellent point. Excellent. All right.
I was just on the internet yesterday and saw that there is something called Trump 2020 Care, Trump Care 2020.
Okay.
Have you heard of that?
I am not. And what did it say it was going to offer?
I did, you know what?
It was on Facebook. I didn't read it.
I
Scared me.
don't go any further than that because they want TMI and I don't want to give my phone number and all that jazz out for everybody to be calling me and emailing me.
Yeah, I haven't seen that on the Medicare.gov website, and that's my rock to go to.
More fake news.
Yeah, and Harris is looking at Medicare for all. So, you know, there's lots of campaign issues going on right now.
So I have Blue Cross Plan C.
You'll be able to keep that.
I will be able to keep it if I can afford it.
Right. Right. Or look at extra help.
Will it continue?
Yes, that's what they're saying.
Yes.
They'll continue if you have it currently?
Yes.
You can only sign up for 1 year and then it's discontinued? I thought you said-
It's Plan C and Plan F are going to continue is what the Medicare Center has told us.
Okay.
It's not in writing. It's just verbal. It's just verbal, it's not in writing?
Oh, no, it's in writing.
Okay.
It's in writing. It's in writing. Good point, yeah.
So you mean, it's not gonna be available for others to sign up for?
After,
If you
no,
have it,
you can
now,
keep
you
it,
can keep it,
or
and
if
it
you
will
sign up now,
continue.
you can get it and keep it.
And it will continue.
Yes.
What are the dates for open season?
October 15th through December 7th. And I think that's maybe, hopefully on your, it's, actually, no, it's on page 1. Yep, October 15th through December 7th. And if you want to switch up to an Advantage plan, that's January 1st to March 31st. Okay, all right.
I have a question about your original, at the beginning you said something, original Medicare requires a 3-day hospital stay?
To go into a nursing home,
Oh, and Advantage plans don't?
correct. So that is a small advantage to an Advantage plan. And that 3-day hospital stay, that has to be inpatient nights. And sometimes people don't realize, well, they're observation. You may have stayed overnight here, but you're technically considered an outpatient. So for original Medicare, it's 3 inpatient nights in a row in the last 30 days.
Do you ever see that changing, Louise, that they'll drop that rule?
On the Medicare, I don't. I really don't. But what is changing, and we're beginning to see this, is orthopedic knees used to be 3 nights. They're closing that down to 2 nights. So a lot of orthopedic needs might not be qualifying for skilled nursing care.
Got high top is doing them outpatient. They can
Right.
qualify for it.
Right? Exactly.
So if you needed to go to, what, like Regency or something like Medelage or whatever you call it, you wouldn't be able to do that with the original Medicare.
You can go to a skilled nursing facility like that if you have 3 inpatient nights. If you don't, you need a Medicare Advantage plan and prior authorization to go.
So if you had a knee replaced and you had original and you didn't stay 3 nights,
You couldn't go. But you can go to an acute care rehab. So Lake Huron Medical Center has an acute care rehab, and original Medicare could cover that without a 3-day hospital stay, but you need 2 or more conditions wrong with you. So not just a knee, but you might need a knee and maybe generalized arthritis, or a knee and something else. 2 conditions to qualify for acute care rehab.
So that's new then? That criteria is new?
No,
Well, that's the same as it's always been with knee replacements or?
no, the 2-day stay,
Yeah.
that's new. That's the new push.
Back to the hospice issue, doesn't Medicare cover part of that though? I mean, if you're on the Advantage plan, they don't cover hospice, but doesn't Medicare cover that? Regular Medicare?
I haven't quite gotten your whole question.
Okay, hospice care, if you have an Advantage program, you're saying they don't cover that.
Cover what?
Hospice.
Right, you would switch back, you could, without harm, switch back to original Medicare. And the hospice agency would help you do that.
That's a concern.
Not that you explain what is the difference between the Advantage Plan and Medigap? And
Okay, Medigap, the supplemental plans, Medigap picks up your co-pays and deductibles from your Medicare Part A and Part B. A Medicare Advantage plan typically rolls all of Medicare into one payment. So it would cover inpatient care, outpatient care, drug care, medications. Sometimes now the Advantage plans are throwing in vision and dental. So you need to search your policies, check your premiums, and check that your doctors accept that insurance. And if I can help, the hospital phone number is 648-3770. That's at the bottom of the Medicare terms to know. You can always call and ask for Louise. All right. Thank you again for being so wonderful.